Well, we're going to go ahead and get started. I want to say welcome. We have just over 200 people registered for today, and we already have over 100 in the room. And so I'm sure we'll see more people entering as we get going. My name is Dr. Dina Porterfield, and I'd like to take a moment and welcome you to the Leadership Breakfast at Roberts Wesleyan College. We are so glad that you are here with us today. And although we are not on campus enjoying breakfast together, I hope that you will enjoy your coffee or breakfast during this time together. It's been quite a year, hasn't it? None of us could have ever known or imagined how our lives would change when the coronavirus pandemic spread across our world. As leaders of organizations, we've experienced the challenges and pressures brought by the pandemic that required us to actually stop everything we were doing and daily, sometimes hourly, make decisions to implement changes that took us through completely uncharted territory. We have all been subjected to a new crash course in our professional education that could be titled Leadership Through Times of Pivot. One of the bright spots in my pandemic journey was the opportunity to be in meetings with Dr. Michael Mendoza. I am so thankful that he has joined us this morning, and I know you'll agree that he is in a unique position to speak to the leadership challenges of helping people change behaviors, understand the ever-changing landscape, and create buy-in to new behavior needed within the community and organizations. The pandemic has been many things. A crisis, a trial, and in way too many cases, a tragic loss of life. But it has at the same time created an opportunity for us to see people at their best when they are stepping up in new ways to serve and to help those in need, whether as volunteers, as professional workers, or simply as good neighbors. This morning's event is sponsored by the Roberts Wesleyan College School of Nursing, and I would like to take just a few minutes and share with you how the students, faculty, and staff exemplified service to others during the pandemic. More than 50% of our faculty were trained and performed COVID-19 testing for the campus community. Faculty, who are also family nurse practitioners, have served in the health center and provided contact tracing, COVID testing, and follow-up for individuals in quarantine and isolation. The School of Nursing donated supplies to the University of Rochester to help with shortage of personal protective equipment during the early phases of the pandemic. This included N95 masks, face shields, gowns, and gloves. Staff members assisted during the initial COVID-19 testing clinic to help assure we had equipment, supplies, coordinated signage, and help with data collection and data entry for required reporting. A faculty member served on a team of 14 healthcare professionals with the University of Rochester to serve New York City early in the pandemic. This trip was in response to a call to assist healthcare providers at the epicenter of the virus. This experience helped give insight to the response in the Rochester community. Several faculty healthcare professionals provided care to individuals impacted by the pandemic, specifically in public health, emergency departments, and with Mercy Flight. You know, these are just a few examples of how our Roberts community cares for our greater community. Faculty and staff giving generously of their time while shifting their own work online and supporting students through this year. I am sure there are many more examples of this kind of service and sacrifice in our audience today. And I just want to say thank you to each one of you for all you have done to support your teams and the greater Rochester area. Before we proceed with our program this morning, I would like to begin with a word of prayer. Will you join me? Heavenly Father, we thank you for our rich history, rooted in the faith and leadership of individuals who are dedicated to acting on the behalf of others and on what they believe. We are so blessed to live in a land of opportunity and freedom where we can come together as a community to learn from each other and inspire each other to continue to serve in ways that benefit others, especially those less fortunate. We especially thank you for your guidance and your grace during this past year as each one of us has dealt with the pandemic in our own personal, family, and professional lives, and for the hope that we have that better days are ahead of us. We pray for your wisdom today, that you will be equipped and that we will be equipped to build a future that is better for all people. We pray for your will and your purposes to be accomplished. In Jesus' name, amen. At this time, Lisa Tiffin, Director of Government, Corporate, and Foundation Relations, will introduce our special guest. Thank you for being here today.
Thank you, President Porterfield. I could not have framed this morning's conversation any better after the year that we've had and the focus on leading through change and pivoting. Today's guest really needs no introduction. I'm very excited to have with us our Commissioner of Public Health, Dr. Michael Mendoza, with us today. So like many of you, I've spent this last year watching him on TV, listening to him in various webinars, and reading reports and statistics that he and his office have published all the time, guiding us, informing us, and leading us through the complexities of the pandemic. So Dr. Mendoza, I just want to say thank you today for being with us and being willing to share your leadership journey over the last year.
Well, thank you for having me. It's a pleasure to be here.
So before I get to our first question, I'd like to just welcome the audience to participate. You'll see the Q&A is enabled for you to send questions. I will see those. I will try to add in as many of your questions as I can as we go along. So please feel free to use that at any point, and we'll try to pick up your questions and get some nice answers. So here we go. So Dr. Mendoza, and I had the pleasure of talking with you a little bit the other day, and I think I mentioned to you that you've really been the face of leadership for Monroe County throughout the pandemic, for at least the last year or more. But before COVID, I'm not sure that I or many of us knew your name or knew who you were. So can you just set the stage, give us a little context? How did you end up in such a leadership position?
Well, I think most of us who take this role don't take the role with the anticipation that we'll be on camera or in headlines or making headlines. I think most of us enjoy the work because we get to work behind the scenes, under the radar, doing the quiet work of public health, and we really enjoy it. But when I took this role now, gosh, almost 5 years ago, it was at a point when I was really questioning where the future of health and healthcare in this community would go. And previous to this, I was the medical director at a large primary care practice affiliated with Highland Hospital, and I still see patients there as a primary care doctor. But I grew increasingly unsure about how we would move forward addressing the disparities in health in our community, addressing primarily those who are underserved, and bridging the gap between our awesome healthcare system and the poverty that we experience primarily in the city, but also in a lot of rural areas. And so I thought this opportunity to be the health commissioner might be interesting, but I honestly didn't set foot, 5 years ago, 10 years ago, thinking I'd ever have this role. And then, I thought our legacy here during my tenure would be the opioid crisis, if you will, and how we manage that, how we navigate our way through that, and that is still very much with us. And then COVID happened. So I think the moral of the story here is you just roll with the punches, and for me, I don't tend to plan too far in advance. I like to be present and see what's happening in front of me. And I think 5 years ago, there was an opportunity that opened up, and I think my skill set and disposition matched at the time, but I've been evolving ever since. And so a lot of, especially in the last year, I've had to reevaluate my approach to how I lead teams, how I run meetings, how I interact with people who disagree with me. All of that has been a constant evolution, especially in the last year.
Yeah, that's really interesting. You mentioned right off the bat that there's uncertainty in healthcare even before COVID. I think COVID sort of highlighted that.
Mm-hmm.
And I think that, the people who are on this call are all leaders and managers within their own realms. And I think that's important to highlight that there's always uncertainty. And you mentioned a couple of things of not looking too far in advance and rolling with the punches. And, you know, I think those are things to keep in mind as we think about uncertain times and not knowing what's around the corner. Like you said, you thought maybe it would be the opioid crisis, and here it is, you know, a national or international worldwide pandemic. Um, so I know that in watching some of the different webinars, seeing you on TV, you know, that kind of thing, scientific facts and information have been really important in helping people understand or kind of feel comfortable as things change. Even we know this week things have changed, right? So, what kinds of tactics did you use, or how effective was sharing facts when those facts seem to be changing like almost every minute? Was that effective for you?
I borrow a lot from my experience as a primary care clinician in this respect. As a doctor for a lot of patients, I coach people. I don't tell people what to do. I help coach people toward a better understanding. And that understanding is rooted often in uncertainty. When we make decisions about our own healthcare, whether to take a medicine or not, whether to go ahead with a surgery or not, there's seldom a quote right answer. I think what I want to do is coach my patients to making the right decision based on their values, based on their beliefs, based on their plans going forward. And I think I've had to utilize that on a much broader scale with the community. And obviously the community is more than one person, lots of diversity in values and beliefs and plans for the future. But making that assessment based on facts that are changing is not that different in my role as the commissioner as it is as a primary care doctor. And I think science has a way of writing itself over time. I think to the extent that we can be transparent and honest about what we know, about the things that we're still learning about, and the things that we know are untrue. As facts evolve, as science develops, as the community of scholars comes together and publishes or speaks or writes about whatever it is that is becoming more clear, if I can portray that to the public, I think ultimately we'll end up at the right goal. And even though it feels like we're going in different directions often, I think the truth has a way of revealing itself. And so, even now with these COVID variants, I mean, there's a lot that we don't know. But what I can represent is that the numbers are what they are. I have a belief that I understand why they're going the way they're going, but I don't have all of the answers. But I think, when I have a certain enough conclusion, I want to share that with the public. But I don't want to lead off with too many questions, because I also have an obligation to portray some semblance of order, that we're approaching this in a methodical, thoughtful way. But that is one of the hardest things. And with uncertainty comes fear, and with fear, a lot of emotions bubble up.
Yeah.
And I think we have to understand that. We have to acknowledge that. We have to normalize that people will take in facts and information in very different ways. And so I've never wanted to, be the end all of any conversation. I've always wanted to encourage people to have those conversations in their homes, in their families, in their churches, in their community centers, so that people can, evolve toward a more useful, common understanding of whatever it is we're talking about.
Yeah, that's really interesting. I'm hearing two threads there. I'm hearing, you sort of starting and saying, look, I want to be your coach, not your directive.
Mhm.
I'm not here to say you must do and you have to. But rather, here's what I know. Yes, it's changing, and just assuring people that you're going to be as transparent as you can, but share the facts that you know as you know them. And when something changes, say, now we know this. We did say this, but now we know this. And that seems to engender trust, both in the public and perhaps within your teams. And I'm thinking from a leadership perspective, that idea of coaching and also being transparent. But also, there are some things where you can say, yes, we know this, and no, this is incorrect. And so it's that balance, it sounds like. Is that sort of accurate?
I think so. I mean, I think there is a balance between being right too often and right not enough, and also being okay with being incorrect sometimes. Science is sometimes incorrect. Science sometimes leads to the wrong conclusions. But that is definitely a balance, and it's one I try to strike both with the public outside of the four walls of the health department, as well as here in the health department with my colleagues and my inner team here.
Yeah, that's great. So yeah, and I think for any leader, really getting people to follow, right? So that's one of the things, especially in times of great change, where people are nervous or not understanding, why did he say this to us yesterday, and today he's telling us to do it this way, or whether that's the public, but I'm really thinking about like your teams,
Yeah.
your direct reports and your teams of people, which I understand to be it has increased quite a bit into the thousands of your extended team of people who are helping us in Monroe County just navigate this. So did you do anything specific to get buy-in with your direct team or with community leaders? You've got business people saying, hey, we need to make money. We need to have this open or that closed, or those kind of things, or even with the larger community. So are there specific ways of helping getting that buy-in?
Well, I think progress goes at the speed of trust. And I think that the relationships that I'd been trying to develop prior to COVID have really served me well in COVID. And certainly you're not going to agree with everybody. You're not going to see eye to eye with everybody. But even those in the community who I've gotten to know through other, topics or other, issues, having the ability to pick up the phone and not have to introduce yourself for the first time when there is a crisis like COVID has been very helpful. And so I can pick up the phone and say to somebody, how are your kids and how is your family? And then we can jump into whatever the topic of the day is. That has been very, very helpful. Here with my team, though, I could not function. I could not do the work I do in the health department without my team. I often tell them that I feel like they're all doing the real work of the health department, and my job is to sort of bring everybody together. But they do the work that you see day to day, and I have the fortune of being the face of that. But the real work that happens in the health department is all behind the scenes. It's all around me. And I tell my team, I've been working with this team now for some of them my entire time here. We've recruited new leaders, and I've tried to develop good, trusting relationships with them. I have one-on-one meetings with them at least every other week, so that they understand my thinking, they understand my approach to things, they understand when I'm certain or uncertain, they understand how I communicate, and I understand that about them as well. And I invite disagreement. I invite people to offer opposing viewpoints. I don't want to be incorrect, particularly when I'm, saying something publicly. I want to hear what everybody thinks, and we will disagree. And I want that to happen because that's how we arrive at the right decision. I think that's how we sort of course correct constantly to make sure that we're hitting the mark ultimately. But I tell my team, I care more about them as people, as individuals, than I will care about a particular decision or approach to a problem. Because at the end of the day, we can correct problems, we can correct issues, but your relationship has to be there. And I value the people here more than any of the work. And I think that, I hope, is what has engendered the level of trust that we've needed to get through these long hours, long days, long months. So, yeah.
Yeah. If you're taking notes in the home game here, progress happens at the speed of trust, and I just love that. You bring up a few things, that inviting feedback and that relationship, right? I think sometimes as leaders, it's hard to hear criticisms, right? It's hard to hear someone say, gosh, boss, I think you're wrong. Here's why, right?
Yeah.
I think you just didn't get that right. But being open to that, like you said, has enabled you to kind of get things right behind the scenes before you have to put a public face on it.
Mhm.
And feedback like that and being open to it does two things. It makes you a stronger leader, but it also helps engender that trust by building those relationships, because people know that you want to get it right and know that they're free to say that. And I think that's an important thing, even just in the culture of your business, right, or your organization. But a couple of things that some of our audience are picking up on, and very much related to a question that you and I had talked about. One person says, I admire your humble, depoliticized approach to community health. How can we disseminate your approach more broadly? And another person calls it, thank you for your even-handed leadership. It's rare and refreshing. It's difficult to maintain that approach in our is it difficult to maintain that approach in our highly politicized and partisan world? Um, and, and related to that, right, I think I had asked you before, this posture of humility seems to help you. I see other leaders who just say, hey, here's how it is, the end. And that can go one way or another. So talk to us about that demeanor, that humility and grace that you seem to lead us with.
You know, I seldom think that I'm right. I mean, I often have to think to myself, well, if I say something, what will the other point of view be to that? And very rarely is there a 100% right answer. And when there is, I will be very vocal about it, because I don't want to overstate too much. But when something is certain, I will indicate that it is certain. But otherwise, you know, I don't think of myself as humble. I don't think of myself as graceful. I just sort of do what I do, and then this is sort of how it happens. But you know, I want to invite feedback. I want to always know that I've got the right look on things, and I never want to portray myself as the ultimate authority, you know, in most cases, because I think so much, especially with public health, even more so than in clinical medicine. With public health, it's so interdisciplinary, and we have epidemiologists and infectious disease specialists and toxicologists. I mean, these are fields that they don't teach us entirely in medical school. And so public health is very interdisciplinary. And so I think, you know, this job has brought out perhaps more of that humility than even as a physician, because as a physician, you know, I can kind of say I understand diabetes or high blood pressure or what have you. But when it comes to public health, it's so complicated, because it involves the community, involves, you know, faith, it involves, you know, culture and so many other things. And, you know, I just do what I do because it's what feels right. So.
Yeah, and that's interesting. What I'm hearing you say between the lines is that, you know, when you talk about people and relationships, and now you talk about, you know, there's so many things that you're not trained in. It's this interdependence on everybody and what they bring to the table. And I think as leaders, if we can recognize people on our team, people outside of our team, who bring us the experience and the knowledge that we need to put all the pieces together. No one of us could lead anybody through something like this. And then we can even scale that down to just your regular change within your organization. And, you know, let's say you're a for-profit and you're responding to the markets, and there's not one single leader who can do that effectively alone. And what I'm hearing you say is that's another reason why those relationships and why the people are important, is because we need to listen and rely.
Right. And especially during a time like now, when things are so partisan, so politicized, so polarized. You know, I have been very intentional about trying to portray myself as a physician and as a scientist. And those two things by their nature are not political. They are scientific. You know, how I communicate, the way I approach things, that is not necessarily political, but I have to think about the reality, which is that anything I say will get pulled in either the left or the right direction. And it is challenging. It is, to some degree, I think it didn't have to be this way, but here we are. I think, you know, one person had written early in the pandemic that it's not a pandemic unless there is a polarization of communication. If you look back through the history of all pandemics, large and small, you know, when something is sweeping the globe, literally, as this is, it will inherently come up against the political thinking in whatever culture the virus ends up finding itself in. And so here in the United States, we've gone through years now, you know, in the recent history of a very polarized, you know, public. And that is the audience that I have to find a way to bridge. I do think that most people don't live at the extremes of any issue, whether it's political or not. I think most of us are somewhere in the middle, and that's who I have to pitch my message to. but I have to understand that the most vocal people tend to be those that are at the periphery. And so there is this tension when I communicate. How do I convey something to the masses, knowing that the minorities will pull it in one direction or the other? And that is still, even on days like yesterday when we announced that we were entering another surge, that got pulled and politicized, almost within the hour. And, we were trying to figure out how to calibrate that message, how to make sure that we got the right facts out there. People were saying things that were incorrect and distorting it from the start. That was challenging. But that is what we have to do, because, at the end of the day, I want the public to know what I know, and I want them to know what I know and how I know what I know, and to ask questions, because that's how we advance the conversation as a community.
Yeah, that's interesting. I think there are a lot of us that have this idea that, with that grace and humility, and what you say is, look, I'm being who I am, which I'll just call it authenticity. So with that authenticity and the calm demeanor that you present when you tell us these things, like yesterday, I think the vast majority probably think that you're not getting pushback, that, it seems so reasonable. But it sounds like you are getting some pushback. How do you handle that as a leader?
Well, this is where I go back to my team and I say, look, this is what we're hearing. Tell me what you think about that. And it's so easy to brush it off and say, oh, that person's just this or that. But I really try to deconstruct a lot of what I hear. I deconstruct that feedback, particularly when it's, harsh, because I think the harsher the feedback, the more fearful the person who's giving that feedback potentially is. And I wonder to myself, what is this person really trying to say? What are they saying underneath the anger? And what are they worried about beyond the profanity? And I get a lot of that, because that's the heart of what I want to speak to. But that's hard to hear. You've got to peel back the ugly skin of the onion to get to the inside issue. And that is hard. That is definitely hard. But I have a team that, I trust. I ask them for their feedback. I want their honesty. And if they say, look, you might have considered saying something differently, I take that to heart, because that's how I weather a lot of the negativity.
Yeah, I think it's a hard lesson. You used the word hard a few times. I think for any leader, it's hard to hear those kind of criticisms, but really admirable that you look for the person beneath the anger, right? Because a lot of us will lash out with our anger first, right? It's much easier to do, right? But you're saying, look, this person maybe is fearful. This person maybe is confused. This person is uncertain and frustrated. And so maybe it's not all anger, and let me find that and let me discuss with my team, how can I handle that better? And I think that's an amazing lesson for leaders in any situation, because we can have an employee, a supervised person, and anybody, the outside public, criticize decisions that we make. And I often phrase it as, sometimes I know too much and too little. I've heard this much, and so I think I know, but I don't know all the behind the scenes, and so I might lash out. But for leaders, I think you're giving us some really good insight into human nature and how we can just sort of be patient and dig deeper for that person beneath.
And I think all of us in leadership roles know that we don't hear the truth necessarily, or we don't hear the whole truth, because there will always be people who, for good reason, want to wait on the sideline before they share something with us, or they may never share something with us. And so I rely on my team to, feed the information that I need to know, and to vet the information that I don't need to know. I don't, frankly, want to know about every negative letter that comes into my office. I have a team of people looking at that, and if there are themes that they want me to know about, I will hear about it. But I can't read every single negative letter, because it would just eat away at my, every day. So, but I do rely on the team a lot, and the knowledge that as a leader, particularly sort of at the top of an organization, you don't always hear everything that you might otherwise hear. So
yeah, I'm going to grab a few of our audience questions in just a minute, but before we do that, I want to just ask you, I mean, we've got leaders from all different kinds of organization. We have healthcare, we have businesses, we have higher ed, we have all of it. I've seen the list. And so I'm wondering if you could give maybe your top three tips or advice to people who are leading through uncertainty and change. Certainly this whole year, all of us have had to make decisions in our various sectors related to the pandemic. But even before, just like you were saying, in healthcare, there's uncertainty. And tomorrow and the future, we're going to face uncertainty. We don't know what it is. That's the whole point. So
Mhm.
what would your top three tips be for other leaders?
So the first is easy. It's the relationships, and I've spoken about this. I think the relationships help to get the work done, but I think the relationships also are what bring joy to the work. And one of the challenges that I often coach those who I mentor in the healthcare setting or in any setting, what I often ask them to do is to reflect at the end of the day and ask themselves, how do I know I did a good job today? And many times you won't see the outcomes of your work for days, weeks, or even longer. So we can't always wait for the outcome to answer the question, how do I know I did a good job today? And so often I think people recognize that they did a good job today when they gauge that based on the relationships and the interactions and the communications and conversations that they had in a given day. And if you can say that you spoke and conversed and communicated with authenticity toward a common goal, that I think is what makes most days meaningful. Most days are not that different from the previous day, but those relationships and conversations can be. So I think that's one way I think we can get through these hard days and get to the end of a day and say, I think I did a good job because I had these interactions. So those relationships, I think, first and foremost. For me, although this changes based on, where I am in life for the last year and a half, I've really focused on having a creative outlet. And that creative outlet looks different depending on the work that I'm doing. But with COVID and this pandemic, I've needed to have an artistic outlet. And so I've done a lot of cooking. I love to cook. I love to create. It's about as different a way of thinking and existing than my day job is. And so I love going to the market. I love finding whatever's fresh. And I love finding a recipe that brings it all together and take some liberties in the recipe and see what comes out. But so that there's that. And then I guess my third thing, I guess I alluded to this earlier, which is to not overplan, to live in the moment, to be present. It's the advice that my wife and I often work on with each other, which is to listen to understand and not to listen to respond. I think, to be present, to hear what's going on, to soak in and observe and use your senses to know what is happening in front of you, I think is far more important than trying to plan your next step. So really, being present and not over planning. And I'm not planning for December yet because I'm still thinking about April, that kind of thing. So I guess those would be the three things that I'd offer, today on April 9th.
Yeah. Today, right? And I think I'm hearing you say, hold it loosely, right?
Mhm.
Today, this is what I'm thinking. Tomorrow it might be different. I will just say I love the cooking outlet. I have a brother who's a chef.
Hmm.
And so years ago, he and I would go to the market and he'd teach me some of the recipes from my childhood that I didn't have an interest in as a child, but do now. So yeah. So I love that though, having that outlet that's really different from what you're doing and really focusing, as you said, on people and relationships to keep you steady and then not putting that much stock into, you know, 6 months out, 2 months out, 5 years out.
Right.
Live now because we don't know what's changing. And so you have to again hold that loosely. I'm gonna just ask a couple of questions from our audience. We'll see how many of these we can kind of include here. So one of our participants asked, how do you envision preparing and responding to the repercussions of mental health needs of our community post-COVID as we transition into hopefully some kind of new normal? There's just been a huge, impact, especially in our underserved communities. And certainly we're going to experience that even with our workers, maybe people are returning to the office or, those kind of things. So, but we're certainly going to see some mental health repercussions. What are your thoughts?
Well, when I took office here, I said to my team that mental health is the other side of the coin of public health. And we have an Office of Mental Health in the county government, and it exists within a different department, the Department of Human Services, but I've worked very closely with them from the start. Addiction and the opioid crisis is ultimately rooted in our mental health and in our behavioral health. So, what we've seen in the last year and a half has really been an outgrowth of a lot of the ways we thought about mental health leading up to the pandemic. We think about trauma, we think about childhood trauma, we think about the impact that trauma has on the hardwiring of our brains as we develop in our late teens and early 20s. And, we know that trauma has a huge impact on so many social and health outcomes. And as this pandemic has evolved, I've likened it to another form of trauma. Very different from abuse and violence and incarceration, the sort of typical traumas that we tend to think about. But this pandemic has inflicted a trauma of its own kind. And I think when we get out of this, and we have to pay attention to it while we're in it, but when we get out of this, we've got to be thinking about how do we identify the trauma that people have experienced, and how do we help people make understanding out of what they've experienced, and how do they take that understanding to move forward in whatever field or job or social situation they may find themselves in. But the mental health impact on children is going to take a generation to unpack. I have kids of my own. They're today in hybrid learning. They're at school today. They were only at school twice this week. And I know that it hasn't had an impact on them. They've done well, for whatever that means in a pandemic year. But they haven't seen their friends as much as they would like to. And we've had to adapt. And I think nobody really knows what the impact of that will be. But I think a lot of people oversimplify the situation and say, well, it's public health versus mental health, or it's public health versus the economy. And life isn't that easy. We've got to balance it all. And these are all, balls that we're juggling in the air. And there are certainly mental health impacts to being in remote learning. There will be public health impacts to reopening the school. We have to balance what those are, given the uncertainties of what we don't know yet about the long-term effects of this virus. So, but mental health is something that I've long thought about. And I'm glad that the pandemic has brought to light some of these mental health issues. But for those who think that, we're new to thinking about mental health, I guess I'd offer that we've been thinking about this all along.
Yeah, and again, I'll go back to, I think you and I were talking earlier on in this conversation about how COVID has just highlighted issues that were already there.
Yeah.
Just a follow up as I'm thinking and listening to you, what do you think the role of a leader, whether you're, the president or CEO of a company or a supervisor of three people and anywhere in between, what do you think the role is in business or in organizations as that leader, as it relates to your people's mental health? Is it all incumbent upon professionals, or is it incumbent upon all of us?
I think there's definitely a role for professionals. I think we need to be very clear that, as peers or as, untrained professionals, there's a limit to what we can do. And even professionals, there's a limit to what professionals can do. And we in the professional world often have to get consultation from other professionals. But, as a leader, I think our job is to articulate that safety matters, that people's values matter, that we don't tolerate harassment, that we don't tolerate hatred, that we don't tolerate intolerance. We have to articulate those very, very clearly with no uncertain terms. But I think the most important part is that first part, which is that safe space, that safety, so that people can have those conversations. Because I don't have the illusion that people are always going to come to me with whatever concern they have. They will go to the person with whom they feel the most sense of safety. So if I can articulate that safety is important, that, two individuals who work in a department that I don't interact with very often can have a conversation, can support one another, who will inherently have a better understanding of what each other is doing and how they're doing in their role. I think that's my job as the leader. And it is to some sense to be a role model, and that isn't to put up a game face every day. When I'm frustrated, when I'm angry, when I'm sad, I don't wear my emotions on my sleeve, but I have ways of showing them. I try not to be stoic. I try to be steady and calm, but I won't be shy about saying, look, I'm really frustrated about that, I'm really angry about that, or that makes me sad. um, I'll articulate that, so that people know that I feel things that everybody else feels. And I take time off. I have no apologies about leaving the office at 5 o'clock because, I want to leave early some days. So, those kinds of things, just being present, being, and I don't like to think of myself as being at the top of the pyramid. I like to be, on the same level as everybody else. So.
I'm pretty sure you just gave us all permission to leave early today. So uh, take that with you to your workplaces. And Dr. Mendoza said it was okay. Um, but no, I think that's interesting, that role model piece and normalizing, saying, look, I'm frustrated just like you are with this. I'm angry about this thing. This makes me sad. And just being able to articulate and express, which then gives the space to other people to articulate and express. And I think you talked about, just sort of setting up a culture where within your organization, where that polarization, that unkindness is just not acceptable. I think that's important. So I've got a question here, but before I ask their question, apparently your screen is a little bit larger than my screen because I don't see this, but they're wondering if you have an old school iPod behind you. I don't know what they're seeing, but
Yeah, I do, and
yeah,
it works.
okay, I see it now.
Yeah, I do, and yeah. So, and I use it actually because it's connected to the little speaker there.
Nice.
But it doesn't talk to anything anymore but the other speaker. But it's got all my Dave Matthews on it, so I
Great.
do try that.
I will admit to also owning one. It's connected to my treadmill so that I can hear the songs I like. So this person, their actual question, by the way, they're saying, how do you respond to an organization? And they use the example of a church that just keeps doing what they want to do. Their example is a church who has a service with no one has to wear a mask. But it could certainly be any other context. We've certainly seen different restaurants that, early on had some issues and needed to be dealt with. But how do you deal with, in general, organizations or sectors or people who just don't want to listen, and other people feeling like, gosh, you're putting all of us at risk? Is there anything you can do, or do you just have to move on?
Um, you do have to move on sometimes, but that's always the last resort. Actually, the last resort is enforcement and fines. That's the last thing I ever want to do. The first thing I want to do is reach out and have a conversation and try to understand. I want to make sure that if people are coming to a decision, that it's based on facts that I think they need to know. And if we come to a different understanding of what those facts are, that's maybe okay. But if people don't have the facts or don't have clarity, I at least want to make sure, because I feel like that's my responsibility, to make sure that a restaurant or a church or a synagogue has the right understanding and the right facts, and that they hear the feedback from me. And I have a bully pulpit, if you will, and that I can offer feedback without being asked for it. And so I will say to a business owner, I've heard complaints from your employees who indicate that they feel unsafe in your workplace. And I don't think any employer wants to hear those words, because unsafe workplace is generally a buzzword for things that we have to change. And I will use those words very intentionally when I hear that something is happening at a workplace, and that's what I'm hearing as feedback. So I will offer that to a business owner or to a church leader, and then I hope that they will think about that, internalize that. But I have to approach it with sensitivity, because if I don't do it in a way that's sensitive, then they won't listen. If I set up an adversarial conversation from the start, we're going nowhere. So I try to understand where people are coming from. I try to hear where they are. I validate what they're doing, because people are doing things right. Nobody's entirely wrong. And then we try to meet in the middle. And then my goal is a second conversation. If I can leave a conversation knowing that I have a second conversation, that I know I did it right, or at least I did something right. Because again, if you can't have a second conversation to allow people to digest and think through and internalize and, vet whatever I'm sharing with other people who are more trusted, colleagues than I, then, you're not going to get anywhere. And I think most people will come around slowly. And so I have to have patience. There are days I just wish that I could snap my fingers and a business would do X or Y or a church would do whatever. But, life doesn't work that way. So that's sort of how I approach things. And then, the last resort is, finding people and punishing people. And we have the ability to do that. And we have done that so rarely throughout this pandemic because I think people respond to things better than punishments and fines. So.
Yeah, and well, you said something. You said, your goal is a second conversation, and I think that's just huge because a lot of times we go in with our goal is to change their mind. Our goal is to get what we want, right? Our goal is to make it all better. But having a goal of a second conversation, uh, that's just really valuable. That's really valuable. That really strikes me because I think we all fall into that trap of I want what I want. I need them to come in line. And if you had approached it that way, then I think we would see more fines and that kind of thing. And then you're breaking trust, right? And you've got this push pull. Whereas the second conversation, if you can just get there. And my guess is when you get to your second conversation, your goal is a third conversation. Just a guess, right? But if we can
Usually.
keep the lines of communication open, right? I
Yes.
think that's a really valuable lesson.
Yes.
Great question here that I want to ask you from the audience. And something I've thought about in terms of COVID is that there are opportunities also that it has presented us with. So this person says, can you list a few positives that will come out of the pandemic, especially as it relates to the future of public health?
Mm-hmm. So many things that I think we can do in public health as a result of this pandemic. And I've said it in so many forums that the vaccination program is the largest public health undertaking of our generation. It has and is shining a light on all of the cracks that we have in public health. And public health has, existed as long as medicine has. Both medicine and public health were born, if you will, in roughly the same era. But medicine has evolved greatly thanks to technology and science and a lot of funding over the century. But public health hasn't enjoyed that success. And if you look at public health, and by the way, public health is more than just health departments. Okay, health departments are just a small part of public health. But when you look at health departments are structured generally around the health issues of the 1950s and 60s, where most of the employees are in the sanitation division. So the restaurant inspectors, very important work. But if you look at the burden of chronic disease on health and public health, that has a far greater impact on mortality and life expectancy than sanitation does, because we've come such a long way in the field of sanitation. So much of public health has been outsourced, if you will, to healthcare, to other agencies. But public health, by its very nature, is about prevention. And when you look at the healthcare dollar spent in the United States, only about 5 cents on every dollar is devoted to prevention. But if we could prevent much of the chronic disease burden that is what explains the greatest level of mortality and reduction in life expectancy, we could be a much healthier nation. When you look at the top 10 public health achievements of the 20th century, taken together, they explain a 25-year improvement in life expectancy over the 1900s. There isn't a single chemotherapy or medication, not even aspirin, can claim to have that degree of improvement in public health. And that all those public health interventions are around prevention. So I think if we can show the public and our lawmakers and policymakers the impact of prevention on health, that I think is the holy grail of what we might come out of this pandemic with. Certainly, more funding is likely to come to us, hopefully, but funding is transient. When we look back to 9/11, there were huge improvements in funding to public health. Largely has all been, reduced back to pre-9/11 levels by this point. So we didn't do a good enough job in the aftermath of 9/11 to underscore that preparedness is really important. So we've got to take this by the reins now and demonstrate to the public the value of prevention.
Yeah, yeah. Thank you for that. We are, boy, the time is going very fast. I'm going to ask one more audience question, then I have a final wrap-up question for you. So this person says, Dr. Mendoza, you're a fantastic communicator. Can you talk about how you approach your communication and your messaging? What's your secret for being such a good communicator? Tell us all your secrets. Go.
Oh, goodness. You know, I don't know that I have any secrets. I just sort of think out loud sometimes, I guess. But um, whenever I hear a question, I again try to come back to what are the one or two things that somebody wants to understand from that question. And then I approach it sort of as though I was asking the question myself. And I think through, well, what would I want to know? What are the things that I might be uncertain about? And what kind of resolution can we arrive at given the certainties and uncertainties of whatever particular situation might be? But I don't know. When I hear questions like that, I just try to, I often shoot from the hip. I often, don't think too hard, but I try to be thoughtful at the same time. And I try to use, I borrow from my role as a family physician, trying to use language that's accessible to people that, isn't overly jargony or overly scientific. Because I think if my message isn't understood, then there's really no point in delivering it.
Yeah, and I'm hearing this big thread of it's really not about you, it's about them.
Yeah.
And that's what I'm hearing all throughout all of your answers. And, the authenticity of being who you are, but also just being able to put yourself in someone else's shoes, whether it's your team, whether it's people who are angry and fearful, whether it's people who need answers, whether it's people who are following or not following rules. I'll call them rules, they're guidelines.
Mhm.
But all of this, and then when you're communicating, that's the thread I'm hearing. And I think that's a huge takeaway for us. And I want to say thank you for that. Um, I might have lied. I'm going to ask you this question. If we have time, I'm going to ask you one final. And if we don't, I won't. But when you and I talked, you talked a little bit about the next generation of leaders. And I know that that's something that's important to you, education. And certainly we're sitting here in a virtual room, but we're representing the college. And, we obviously have a mission for our next generation of leaders. Why is that important for you to pay attention to young people and that next generation?
Gosh, well, I think this really gets at sort of what is our meaning in life, and I think to myself, what is my meaning as a parent? And my goal as a parent is to help coach my children to be upstanding, noble, thoughtful, intelligent members of society. And as leaders, I think we want to leave our organizations in better hands than we inherited them. So I value those who come to the health department. I coach those who want to be leaders someday to have the skills that they think they need to develop into the ways that they want to develop in to be a leader. Nobody told me that I had to go to business school. I figured out pretty quickly in my previous job that I probably ought to go to business school to understand some of the things I didn't understand. I want those who follow me to have the freedom to figure out what it is that they need and to have appropriate mentoring and coaching so that they can feel good about whatever it is they think they need. But I do think that we're entering an era where we need to value diversity in our leadership more than we ever have before. Not just for diversity's sake, but because diversity brings about better outcomes. I think diversity brings about better perspectives, and we have a diverse society. And I think that if we don't value diversity in leadership, we will never be able to be truly authentic organizations. So that is, I think, an added responsibility that we have currently as leaders, is to look ahead and look up the pipeline, make sure we're recruiting people into our field. And so in primary care, we know through a lot of good science that the way we expand access to primary care is to expand the diversity of those who are entering, medical school or entering scientific fields in college. And it's not just racial diversity, it's not just ethnic diversity, it's in socioeconomic diversity, it's in urban, suburban, rural diversity. We don't have enough physicians or healthcare providers in rural settings, and some of the most underserved settings in our nation are rural settings. And we often overlook that. So I think we have an added responsibility as leaders in 2021 to be valuing diversity.
Yep, that's excellent. And so I will ask, it's one of our participants, and I know that you said you don't plan very far out in advance, but the question is, what's next for you once this pandemic is over?
So a mentor told me once early in my career that your job isn't to know when you want another job. Your job is to know when you're at least at your halfway point in your current job. And I don't think I'm at the halfway point in my current job. So I've been in this job now for 5 years. I think I see myself in this role for at least 10 years, maybe longer. But when I get to the point where I think I'm at the halfway point or past the halfway point, I'll be thinking about what next. But right now I'm not thinking about what's next because there's a lot that I want to do here in the health department. But if I'm here for another 5 years, that puts me in my 50s. I've hopefully got a lot more, life after that. I'd like to someday own a coffee shop and have books there and magazines for people to read. That is my dream someday. That probably won't be my next job, but what's going to be in between, I have no idea.
I like that. There is life after 50, just so you know. But thank you. I think that's really good news for all of us, that you're settled in and that we will have the benefit of your wisdom and your leadership for years to come. Dr. Mendoza, I just want to say thank you so much. I can't even imagine the notes that people have been taking and the just really, I'll call them pearls of wisdom that people may go away with today. So thank you so much for being here. For our participants, thank you so much for being here, being so engaged. I could not possibly have asked all the questions that were in our Q&A queue. However, there is a breakout session, and I'm going to introduce Michelle Blakeman, who does all of our behind the scenes kind of work here and keeps us on track and makes this the success that it is. So Michelle, if you'll give us just a few directions.
Of course. Thanks, Lisa. Just want to say thank you so much, Dr. Mendoza. I have 3 pages of notes. This was such a wonderful conversation, and I know that many people are taking away so many nuggets of gold from this conversation.